Welcome to this webinar all about Lives Expert Training. We provide a range of courses to suit individual and business needs. Today we're going to look at what makes Lives different, the training we provide, and how choosing Lives as your training provider can really benefit you or your company and your community as well. So my name's Amy Tancred. I'm going to be talking to you today. I started at Lives in September 2023. Before that, I worked with children with severe physical, behavioural and learning needs. So education is something I'm really passionate about, and I've seen firsthand how the right education can make a huge difference to people's lives. I'm also a community first responder at Lives. So again, I've seen firsthand how the charity benefits people in the community, but also benefits the responders themselves when they have the skills and the knowledge and the confidence as well to help people in need. So let's have a look now at more about what Lives is and what makes us special as well. As you can see from the picture, there are many different training providers out there. So why should you choose Lives? Well, to start with, Lives is a charity. We provide voluntary response across Lincolnshire so that the time that people have to wait for help to arrive is drastically reduced, and so that patients and their families can get the help and the support that they need. So by choosing Lives as your training provider, you're directly supporting a life-saving charity, as all profits go straight back into providing more equipment and training for our responders. We also put a big emphasis not just on our clinical skills, which are really important, but on our education skills and knowledge as well. We try to keep up to date with the latest teaching styles and methods, including how to make our teaching more accessible to neurodiverse people, people with disabilities, and those where English is not their first language. This is especially important in Lincolnshire, as according to an article written in 2024, around 10% of the population in Lincolnshire don't have English as their first language. So that's something that's really important. At Lives, we also believe in getting hands-on and making training realistic, but also making sure that people have the confidence to use the skills that they've learned, not just the knowledge, but the confidence to act as well. One of my favourite quotes is from Thomas Caruthers, who is known for his work in educational philosophy. And he said this quote here: "A good teacher is one who makes himself progressively unnecessary." I think that really nicely sums up what we want to do at Lives. Our goal is to empower people so that they can confidently act in an emergency without us there. But why is this so important, and how can this impact you or your workplace? Well, a study by NHS England has shown that the ambulance service responds to around 40,000 people requiring resuscitation each year. So it's obviously a huge figure, but 15% of those occur in the workplace. So that's around 6,000 people each year that are having a cardiac arrest in the workplace. Again, a significant figure. But studies also show that 50% of these cardiac arrests are witnessed by a bystander. However, many people are either too scared to act or just don't have the knowledge and skills to do so. But why does this matter? Surely the ambulance is on its way and they definitely know what they're doing, so surely it doesn't really make much of a difference. But actually, further studies have gone on to show that bystander CPR can make a huge difference. So when they examined more than 200,000 cases between these years shown, they found that people who received bystander CPR were 81% more likely to survive than those who didn't. And the former group also had a 95% chance of surviving without significant brain damage as well. Whereas people who didn't receive bystander CPR had a 12% chance of survival, and around 9% survived without significant brain damage or major disabilities. So in these situations, minutes really do matter. And if you've had good training, if you feel confident, you will be ready to act when the worst happens, or if the worst happens, I should say. But what's even better than providing really good, effective CPR? Well, preventing a patient from getting sick in the first place, that would be the goal. It's not always possible, but again, with good training, hopefully we can stop a more serious medical emergency from happening. Because having competent first aiders within our organisation, or being a competent first aider ourselves, will mean that we can recognise the signs a patient is not well and prevent it. So that could be either by just cleaning and dressing a wound effectively, or it could be by saying, okay, I think this person needs to go to A&E and getting some more help there. All of this makes such a massive difference, and it's all part of the chain of survival, as you can see in the picture there. The first step is early recognition, making sure that person gets the help they need when they need it. And then if we can't prevent this from happening, or if something happens right in front of us, providing that early CPR. Again, those minutes really do matter and they make a huge impact. Then using a defibrillator as quickly as possible. All of those things are taught in our courses, so that you'll feel confident to do all of that. And then getting them the help that they need as quickly as possible. And a big part of that is giving accurate information to the ambulance service. And that's also something that we teach in our courses as well. This is something that we'll also talk in more detail about in our second webinar episode. So I won't go into too much more detail about it now. But it just shows what a huge impact good training can have. And obviously to deliver that training, you need trainers. And this is our core team here at Lives. So what makes Lives stand out is our expert trainers. Expert does not mean that we know everything about everything. We definitely don't. But we are always trying to learn more and always sharpening our skills, both clinical skills and teaching skills as well, to give you the best training possible. Another vital thing about our trainers as well is that all of us have real world experience of treating patients. There's quite a common saying, isn't there, of those who can't do teach, but in Lives that could not be less true. All of our trainers are volunteer community responders, as well as having other clinical things that they do as well. So they go out to help people on what is most likely their worst days, so they know exactly how it feels to be in that position. So let's meet the team then. First of all, we have Curtis Dorban. Curtis is Head of Funded Services in Lives. So that means he leads income generation to support Lives, emergency medical and education services. He has many years of teaching experience and is a critical care paramedic, so the real world experience clinically as well. As you can imagine, he is extremely busy, but when he can, he also teaches courses within Lives as well. And then we have Emma. If you are thinking you recognise that surname, that's because she's my mother-in-law, but she's also our education manager as well. She's responsible for overseeing the training and development of both our volunteers and our customers to make sure that they're equipped with the necessary skills to respond effectively to medical emergencies. She has over 25 years of education experience, and again, when she can, teaches courses within Lives as well. And then we have Adam. Adam is a qualified paramedic with many years of teaching experience as well. He's written many bespoke courses in Lives as well, which is really important to help provide customers with training for the specific needs of their company. One of those courses is the hydrofluoric acid course, which is all about what hydrofluoric acid is, how to use it safely, and then how to treat a burn if one was to occur. And it's been a huge help to the company that needs this training and helps their staff to feel more confident and better prepared. So that's really important. And then we have Michael Scragg. Michael is a critical care paramedic with 7 years of teaching experience. He's also written many courses for our online academy, and that really helps people to expand or reinforce the learning they've already done on our courses. And he's also been instrumental in getting many of our bespoke courses accredited by CPD and me, which is really important. And that not only helps us as educators within the organisation to keep up to date with the most clinical understanding of things, but we also deliver some of these courses to East of England and East Midlands Ambulance Service, which then in turn benefits the community as well. Then we have Michael Waddycore. He has over 40 years of education experience, both with Lives and with other organisations as well, and has responded in the community for over 10 years. He's also usually much jollier than his picture shows, and he has a really important role within Lives of mentoring new responders. He makes sure that they settle into the organisation and that they keep responding with us as well, which is really invaluable within the organisation. And then we have Chloe. Chloe has been an educator at Live since September 2023, but before that she was a first responder and also a casualty actor. So casualty actors are used within some courses instead of mannequins. I'm going to talk about them a bit later on, so I won't go into too much more detail about what they are now. But that's what Chloe did beforehand. So now she is not only an educator, but she's also casualty actor lead. So she makes sure that every course that needs a casualty actor has one, and also make sure that all of our casualty actors are well looked after as well, because often their job is not very glamorous. So she makes sure they're all well looked after. Then we have Tim. Tim is an educator at Lives and has been a responder for 6 years. He supports with the development of content specifically for our community first responders. And then we have Daryl. Daryl's been an educator at Lives since May 2023 and a responder for 11 years. He is first aid lead, so that means that he helps by looking after the equipment that we use for first aid, making sure it's in good condition, ready to be used, and that the wider team are aware of any updates to courses as well. So that's our core team. Obviously there's me as well, but I've already talked about me. So that's our core team. As well as that though, we also have some really amazing bank staff with a whole range of experience and skills. But I'm not going to talk about all of them now because that would kind of be the whole the whole webinar that would take up. But we have some amazing bank staff as well that help out. So that's the team who are going to come and teach you. But what are they going to teach? Well, we work with a range of awarding bodies to deliver a really wide range of courses as well. So QualSafe, for instance, QualSafe is one of the largest Ofqual recognised awarding organisations in the UK and are committed to raising industry standards. We also have Mental Health First Aid England. They are the only provider of licensed mental health first aid instructor courses in England. So it's really great to be able to work with them. Resus Council UK develop national guidelines, influence policy, and support cutting edge research. And then we have NAEMT, which is the National Association of Emergency Medical Technicians. It's the only national association representing the professional interests of healthcare professionals. Obviously, there's a few more on there as well, and I'll go into a bit more detail on them in just a second. But us working closely with these organisations and teaching their courses can give you the confidence that we will maintain professional standards and that we're always trying and striving to deliver the best courses that we can. So which course will work best for you or your company? We'll have a look at them in more detail now. So with QualSafe, we teach quite a range of courses. We teach a one-day first aid course, which covers how to do effective CPR, use the defibrillator, as well as other emergencies like seizures or choking. And then we have a 3-day version of that as well. First aid at work, that's called. And it goes into a lot more detail and covers medical conditions such as strokes, diabetes, and it also looks at things like broken bones and head injuries. And both of those courses are great and are really good for low risk environments. So there are 2 first aid courses, but we also do paediatric versions of those. So ones that are specific for workplaces where they work with children. because they cover emergencies more specific for children, such as meningitis, febrile convulsions, things like that. Then we have the Moving People Safely course. That goes into how you can look after yourself and your patient whilst moving them. And it also covers a variety of equipment as well that you could use. Then the other courses we teach with QualSafe are the FREC courses, so First Response Emergency Care. And we have the different levels of those. Those qualifications are really ideal for people seeking a career in emergency services, the ambulance service, the event and security sector, or those who work again in high-risk workplaces. So it's a 5-day course. Those are the FREC 3 and FREC 4 are. And over those 5 days, learners will gain knowledge and skills to deal with a wide range of pre-hospital emergencies, such as managing a catastrophic bleed, how to deal with a patient's airway, management of fractures, many more things like that. So they're the courses we teach with QualSafe. And then we have QN UK. With QN UK, we offer 2 courses, so 3 actually, I've just realised we offer 3 courses. We have FTAC, which is First Aid, Trauma and Casualty Care, BTAC, which is Basic Trauma and Casualty Care, and RTAC, which is Rescue Trauma and Casualty Care. So those 3 courses that we teach. The First Aid one is obviously quite a standard first aid course with a bit of trauma added in. Then Basic Trauma and Casualty Care is a 2-day course, and Rescue Trauma is a 3-day course. They all include what's covered on your standard first aid course, but they're fantastic for high risk environments where if there were to be an accident, it would be quite catastrophic because it's very trauma focused. So it focuses on how to act quickly, but effectively. And within these courses, this is where we use our live casualties. So we'll just have a little look at casualty actors. So what are casualty actors? Why do we use them? Well, casualty actors at Lives are usually responders. So they're usually first responders with us. They have makeup and prosthetics put on them to look like they have been injured, and then they play the part amazingly well. They're so good, our casualty actors. They will be either shouting in pain, crying, or just being completely unconscious throughout. Because they are responders, they have a really good, excellent understanding of how a patient would react to pain or treatment. So this really helps these scenarios to be more realistic. It also helps because instead of your instructor standing there next to a mannequin saying, oh, he says his leg's hurting, oh, he's gone unconscious now, they can actually see it. The CAS actor is doing all of those things. So the student can see that happening in real time. This really embeds learning and helps to give learners a lot more confidence in live situations because they've already dealt with a live casualty. They know how to do that. So if they have to in real life, they will have the confidence to do that. That's a bit about our casualty actors and a bit about our trauma courses. Again, great for high risk environments. Then we have our NAEMT. So with them, we do PHTLS. There's a lot of acronyms in here. Sorry about that. Pre-hospital trauma life support. So that is a comprehensive training course designed to improve the care provided to trauma patients in a pre-hospital setting. It's aimed at healthcare providers, so EMTs, paramedics, nurses and doctors who are responsible for delivering care to trauma patients before they reach the hospital. And this course is exclusively taught by our healthcare professionals as well. Then we have the difficult airway course. This does what it says on the tin, really. It looks at how to deal with difficult airways, either due to trauma, age, or medical emergencies, how to anticipate a difficult airway, and then steps to take to deal with it with a full range of airway management techniques. Then we have mental health first aid. This course is a great course. It's very interactive and it's designed to develop the skills to spot the signs of a person experiencing poor mental health and then have the confidence to start a conversation about it. They'll also learn the tools to signpost people to the appropriate help and support so that everyone can thrive. And this is so important within the workplace to help boost and support employee well-being, but also really important now that we have a lot more people working from home, or maybe they're hybrid. So it deals with how to look after people, even in a changing workplace environment. And then with Resource Council, we do immediate life support, which is kind of your step up from basic life support, which you do at a first aid course. So immediate life support includes how to use airway adjuncts, monitoring, and it's designed to equip healthcare professionals with the knowledge and skills required to manage medical emergencies and cardiac arrest situations. So they're just a couple of our courses. I realised it was a bit of a whistle-stop tour through each of them, but you can get a lot more information on our website about those courses. The website is training.lives.org.uk. We also have a whole range of CPD courses on there as well, so please feel free to have a look at those because they're fantastic as well. So they're the courses we offer, but how do people feel about attending these courses? How do they feel after they've been to them? We'll just have a look at some feedback here. So sometimes when we get to a course, people can maybe start out a little bit unmotivated, maybe they didn't really want to be there, or they're extremely nervous. But by the end of the course, they're so happy with the skills that they've learned. And some first aiders on courses have actually gone on to be responders in the local community, which is really nice. And then that training that they get is invaluable then for the workplace as well. Such as this person here. So they were very nervous because, as it says there, they didn't feel they were the best readers. But by the end of this first aid course, they felt so much more confident that they actually went on to do a FREC 3 course, so a 5-day course, because they felt so much more confident and they enjoyed the skills that they had learned. So that was really lovely. Another lovely bit of feedback is this one here. Within our courses, we do always try to make them quite light-hearted and fun if we can, because when you're having fun, you're learning. But we can't get away from the fact that sometimes we do have to have awkward conversations when it comes to healthcare, or maybe it's a topic that is quite emotive for a person, brings back memories maybe. Or we have people maybe on first aid courses that are quite squeamish, so we have to be able to deal with that as well. And that's something that we always try and do. We try to make people feel as comfortable as possible and always give them time to be able to speak to us outside of training within breaks and things so that they can talk to us about anything they might find difficult, and we can adapt the course where we can. As much as we can, we try and adapt the course again to make people feel comfortable. We always ask for feedback at the end of our courses. It's something that's really important to us because it's the only way we can keep improving and learning. We want to know exactly what went well, but also sometimes what didn't go very well, because then that's equally as helpful and appreciated. Because by looking through the feedback, management then look for trends or other things so that they can tailor our quarterly staff meetings to areas where maybe we need to refine our skills or where we need to just keep doing what we're already doing. So that's really important, and we really do appreciate all of the feedback that we get, and it's nice to see that we do get positive feedback. And again, hopefully it can give you the confidence that you would enjoy a Lives First Aid course or any course that you choose to do with us. So as a little recap then, why should you choose Lives as your education delivery partner? Well, by choosing Lives, you're supporting a life-saving charity that supports the local community. You're choosing a charity that also will give your employees the best chance of feeling confident and ready to step in an emergency. You're also getting experienced trainers who not only understand how it feels to deal with a patient, but also understand learners' individual needs and how to adapt our teaching style to that. You also get a range of courses and CPD opportunities, as well as bespoke courses, especially tailored to your company's or yourself, your individual needs as well. So that's a little recap on why you should choose Live's expert training as your provider. Thank you so much for being here and for listening to me today. If you would like to ask any questions, feel free to put them in the chat. If I can't answer them, I will make sure to signpost you to someone who can. But yeah, if you have any questions, feel free to ask me. And again, thank you so much for being here on our first episode. Don't forget to sign up for our next episode that's coming out on the 7th of May. Thank you again.